have fibromyalgia? If you do, you want to listen up. I've got some information that's going to be really helpful. Hi, I'm Dr. Rodger Murphree, and I have specialized in treating fibromyalgia for over 2 decades. And I've developed protocols that have clinically been proven to help those with fibromyalgia get their life back, to dramatically reduce their symptoms and help them have a normal life. Unfortunately, right now, what we hear in the medical community and even functional medicine practitioners like myself oftentimes don't really understand fibromyalgia, and because of that, they tell you just to learn to live with it. But no one needs to learn to live, or should have to learn to live, with chronic pain, feeling exhausted, run down, struggling with fibro fog, irritable bowel syndrome, and gut issues, and feeling anxious or depressed because life is passing you by. No one should have to struggle with the flares, the fibro flares that come with overdoing it, which could be something as simple as, trying to cook dinner for your family, or cook dinner for yourself, or maybe even just trying to do a crossword puzzle, or for some of my patients, even walking to the mailbox can set them off in a flare. Trying to live with that mess is not living, it's just existing. So what can you do to prevent fibro flares? Well, the first thing you've got to do is get deep restorative sleep on a consistent basis, preferably without drug therapy. And I go into more detail about that. You can get a special report on my website, endfibronow.com. You can also check out my website, yourfibrodoctor.com, to learn more a little bit about that. But deep restorative sleep is the first big step in the right direction. Now, once you start sleeping through the night, you're going to have more energy, you're going to have less pain. Mentally, you're going to be sharper, and irritable bowel even improves just by getting deep restorative sleep on a consistent basis, preferably, as I share with you in that report, doing it naturally. The next step, though, is how do you prevent having these fibro flares? What I saw early on in my career is I would help patients start to feel better, get a good night's sleep, get stronger mentally and physically with nutritional, more natural protocols that I've developed over the years, helping them to navigate away from drugs when they can and use a more natural approach. But what would happen is, after reestablishing deep restorative sleep, where they were feeling better after a couple of weeks, then they were still vulnerable to fibro flares. And that's when I realized that these patients, my patients, had a thing called adrenal fatigue. Now, adrenal fatigue is something that's not really discussed in the conventional medical world, but in functional medicine, we understand it quite literally, because we know that everybody's different. Yours is different on the outside as you're on the inside. And when we look at laboratory testing, if we just go by what is the normal, we really miss the boat in people who are what I call medical misfits. In a nice way, fibromyalgia patients are medical misfits. These are patients that oftentimes just don't fit in the traditional medical box. They just don't fit there. And there's really not a lot of information or therapies for them that really do work. In fact, drug therapy is very much a dead end for fibromyalgia long-term. But if you can get deep restorative sleep, then the next step is to protect yourself from flares, is to build up your stamina and resiliency, which you've lost because you have a thing called adrenal fatigue. So your adrenal glands are two small stress coping glands that sit on top of your kidneys. And anytime you're under stress, real or imagined, your adrenal glands are releasing certain hormones like cortisol to help you deal with that stress. But if you've been a typical fibromyalgia patient, that I've seen, and you've struggled with poor sleep for years, you've been under stress, had poor health, been sedentary, eventually your adrenal glands, they're bankrupt. They don't have anything left to give you. So when you are under stress, they've got nothing. And now you're vulnerable to little things like bright lights, loud noises, just mental tasks or physical tasks, trying to work in the garden or do something as simple as sweeping the kitchen floor or cleaning up the kitchen can set you into a flare. Even worse of a flare if you have to travel or interact with family or host people, at your home. Things that really mentally can be very taxing. But when you have adrenal fatigue and your adrenal glands are not able to supply this cortisol, then you not only are vulnerable to any kind of stress, but you also tend to have more inflammation and more pain, less energy, both mentally and physically. So what I saw early on was research about cortisol, which is a prescription, Cortef, which is 1/5 the strength of prednisone, which is what most people associate with steroids. When you take a dose pack for a sinus infection or upper respiratory infection or a low back injury, a lot of times you're on prednisone or you're on a dose pack. That medication is given out sparingly because if you take high doses or for long term, it can cause some unwanted side effects like weight gain, water retention, and other things. It can actually suppress your immune system because it's just too much. But what I found was if I could get my patients on an over-the-counter supplement called Adrenal Cortex, which was still effective but didn't have the side effects, I could help my patients avoid having fibro flares. So once I get my patients going to deep restorative sleep using 5-HTP and some of the other things I talked about, the Fibro formula that I've developed over the last several years, several years, decades, 2 decades anyway. Once they start using these protocols, and you can learn more about these protocols at endfibronow.com. But once they start using these protocols, they start to see now they have more stamina, more resiliency to stress. Until they start to fix their adrenal fatigue, and I recommend using an only adrenal cortex with nothing else in it. It shouldn't have anything other than adrenal cortex, and that's it. No other formula. You can see more about that in a jumpstart video at yourfibrodoctor.com. There's some videos there you can check out. They're free. But I go into more detail about all this at END Fibro Now. It's a special report. You can check that out. But once you start to get your adrenal glands to come back online by taking these over-the-counter, natural supplements, you'll see that you have more energy physically and mentally. You'll find you can do more without crashing, without having a flare. In the beginning, it's kind of maybe subtle. You find that now you're able to be more active during the day. You don't have to take a nap. You can get out of bed sooner. You can go do things longer without having to totally lay down. You can get in more stressful situations, whether that's going grocery shopping or going out with friends or even taking a walk around the block, and actually be able to do that and not have any poor effects from that, because you've got the cortisol, the stress coping hormone in your system that you so badly need. So you can learn more about this at yourfibrodoctor.com, and you can get a special report. It's free at END Fibro Now. I'm Dr. Rodger Murphree. I've specialized in fibromyalgia for over 20 years, and I've put together protocols that have been clinically proven to help my patients and help those with fibromyalgia to overcome their fibromyalgia symptoms and get their life back. I hope you'll check out the material, and I know it's going to benefit you, so I look forward to being able to share that with you.